Navigating the U.S. healthcare system can often feel like trying to solve a complex puzzle, especially when it comes to billing. You go to the hospital for a single visit, expecting one bill. But then your mailbox is flooded with multiple statements from different providers. It is a confusing and often frustrating experience that leaves many people asking, why does this happen? In this video, we'll break down the intricate web of medical billing in the United States to explain how one hospital visit can turn into a pile of medical bills. The primary reason for receiving multiple bills is the fragmented nature of the American healthcare system. Unlike in many other countries where hospital services are bundled, the U.S. system operates on a fee-for-service model where each provider and service is billed for separately. Let's explore the main components. First, you have the facility fee versus the professional fee. When you visit a hospital, you are using its resources: the room, the medical equipment, the nursing staff, and the administrative services. The hospital charges a facility fee for the use of these resources. This is typically the largest bill you will receive. However, the doctors who treat you often bill separately. These are the professional fees. Many physicians, including emergency room doctors, surgeons, radiologists, anesthesiologists, and are not direct employees of the hospital. Instead, they work as independent contractors or as part of a separate physician group that has privileges to practice at that hospital. So, the ER doctor who initially saw you will send a bill. The radiologist who read your X-ray will send another. The anesthesiologist who administered anesthesia during a procedure will send their own bill. And the surgeon who performed the operation will send one too. Each of these specialists provides a professional service, and they bill for their expertise and time separately from the hospital's facility charges. Next, let's consider ancillary and diagnostic services. Did you have blood work done? The laboratory that processed your tests will likely send a bill. Did you get an MRI or a CT scan? The imaging center or the radiology group will bill you for that service. These services are often outsourced to third-party companies or handled by separate departments within the hospital that have their own billing systems. For example, a pathologist who analyzes a tissue sample will send a separate bill for their diagnostic services. Each test and procedure can generate its own unique charge and, consequently, its own bill. Another layer of complexity is added by your health insurance. Before you even see a bill, your providers will submit claims to your insurance company. Your insurer then processes these claims based on your plan's coverage, including your deductible, co-payments, and co-insurance. You will receive an explanation of benefits, or EOB, from your insurance company for each claim that is processed. An EOB is not a bill, but it details what your insurance covered and what portion you are responsible for paying. Following the EOB, each provider will then send you a bill for the remaining balance. Since you saw multiple providers, you will receive multiple EOBs and multiple bills. Furthermore, billing errors can complicate the process. The U.S. healthcare system is notoriously complex, and mistakes are common. You might be billed for a service you didn't receive, charged twice for the same procedure, or find that your insurance information was entered incorrectly. That's why it's crucial to carefully review every bill and EOB you receive. Compare them to your own records of the services you received. If you find a discrepancy, contact the provider's billing department and your insurance company immediately to dispute the charge. So, to recap, a single hospital visit can generate multiple bills because 1. The hospital charges a facility fee for the use of its resources. 2. Each physician and specialist who treats you bills separately for their professional services. 3. Ancillary services like lab work, imaging, and pathology are often billed independently. 4. The insurance claim process results in separate explanations of benefits and subsequent bills from each provider for your portion of the cost. Understanding this system is the first step toward managing your medical expenses more effectively. Always keep detailed records of your visits. Review your bills carefully, and don't hesitate to ask questions. While the system is complex, being an informed and proactive patient can help you navigate it with greater confidence and avoid unnecessary financial stress.